So, greetings, friends and followers. This is Nurses Talking, and I'm Del Barcy. And here on Nurses Talking, we speak to nurses anywhere on the globe and at any stage in their nursing career, whatever they may be doing, whether they're students or retirees and anybody in between. And so today, I'm very, very pleased to welcome Joni O'Neill. Joni is a nurse of 25 years. She's got extensive experience in multiple clinical areas. She is a coach. She's a board certified wellness coach. She's a certified health math practitioner. She's a certified cardiovascular nurse. And she says her passion is helping people find hope and empowerment. So welcome, Joni.
Thank you.
Thank you, thank you, thank you for doing this, really. My first question always to people is, why are they nurses? So why are you a nurse?
Well, I came to nursing a little bit later. I was one of those students who went to college and who really didn't know what they wanted to do. I jumped majors 4 or 5 times, literally everything from education to Asian studies, political science. I had no idea. I was just trying to figure it out. I got married and had quit school and worked a real job for about a year and decided, oh, wow, I need to go back to school. And it was my husband who said, why don't you go into nursing? And he had said that for a while. And I tell him to this day, and we laugh about it. And I said, if you hadn't said that, I probably would have done it a long time ago. But I finally said, you know what, maybe I should. So I quit my job as the manager of a dental office and went to work as a nurse's aide in a nursing home to see if I could handle it. I figured if I could do that, then I could do anything. So I did that for about 6 months and decided I wanted to go back to nursing school or go to nursing school. And so I went back at like 26, 25 or 26, and then finished at 28 and started my nursing career then. And, I haven't looked back. It was one of the best decisions I ever made.
That's fine. It's okay that you moved around. I mean, not all flowers bloom in spring, bloom in spring. So that's okay. So, as someone who stepped into nursing, though, after having done other things, what kind of challenges were there for you?
Um, to me, I don't think it was more challenge. It was more like, oh, this is where I was supposed to be. And this is what life prepared me for. Through college, through high school and college, I waited tables. I did all kinds of different jobs, just trying to figure out how to live in the world and how to make ends meet. And I'll never forget when I was a brand new nurse, I went into the emergency department straight out. That's exactly where I wanted to be. I took a job there as a tech while I was in school, and I got my LPN while I was a junior. And so that's where I wanted to be. So when I graduated, I started right off as an RN there. And I'll never forget, I was taking care of patients and I had like 3 rooms. One of them was a trauma room, a pelvic room, and just a regular room. And I was doing the patient care, going back between them. And it dawned on me in the hall. I was like, oh my gosh, this is like waiting tables, only higher, higher issues I'm dealing with. But it was the same kind of time management, communication, taking care and connecting with people and providing them the service. In a quick pace environment. And so it fit really well. And so it was funny when that hit me, much larger stakes, but
I get it. But so much preparation. There's so many people who don't have or who never gained that particular experience. And I guess it's what they say, no, knowledge is never ever wasted. It comes to you when you need it.
Yeah, it's always preparing you for something else that you can use that.
Yeah. So you wanted to be in the emergency room. You got there first thing, and then you worked in other areas?
Yeah, well, I worked in the emergency room primarily the first several years of my career. I loved it so much. At one point, I was working in 3 different emergency rooms in the city that I lived, just PRN, but I loved that because each hospital has its own personality. Each part of the city has its own personality. And I loved learning different ways to do the same thing. You know, in
Mm-hmm.
one of the hospitals was more like a county hospital where it was like the wild, wild west. You were doing everything, you were responsible for everything. And then I worked in another hospital in a different part of the city where it was very old fashioned, where, you know, the patients came in, you didn't do anything until the physician saw them, wrote the orders, you know. And so, and then in another one, which was a different demographic, and it was a teaching hospital. So there was so many more experiences there, you know, where they were doing things to teach. And I loved working in those different environments, and I loved the emergency room. And then I moved on to, I think, outpatient surgery. I did some teaching for a pharmaceutical company that had an IV division. So
Okay.
I did certification for IV for nurses in nursing homes, and then
Yeah.
like central line care, that
Yeah.
kind of thing. Trying to think. I did do a short stint in the ICU. Was not for me. When when they hired me, they said you won't last. ER nurses never last. And I was like, oh, but I'm different, you know. I'm different. And I went in, and after about 6 weeks, I was like, oh my God, I hate this. It was too scheduled. The day was
Uh-huh.
too scheduled for me. I
Yeah.
needed to not know what was going to happen.
Yeah.
Um, I'm trying to think what other areas. I worked in med surg very briefly, and I went back to work. Okay, so in 2013, I left the bedside and I moved into health and wellness. I took the position at our medical fitness facility, over just our community health facility, and worked in part of our employee wellness program.
Okay.
Um, and then in 2020, I went back to the hospital to work in our COVID unit. And that was a eye opener because I had been out of clinical care for quite some time. But
Mm-hmm.
it was fantastic. You know, some
Mm-hmm.
things have not changed at all or
Mm-hmm.
don't change.
Mm-hmm. Mm-hmm. Yeah. I was interested that you spoke about the three different emergency rooms because that highlighted really one of the goals of this channel. Because I was fortunate enough to work in different countries, and what I know is that basically nursing is the same everywhere, except it's not really. In different areas, different things are expected of you,
Mm-hmm.
and you function differently. So although you have your basic nursing thing that you're being a nurse, still sometimes you have to navigate some different things
Right.
to expose that. Yeah, yeah. So that's good. So, well, before I ask you about Joni O, having done bedside, you've done emergency room, which your best. You have your turnover, your quick turnover. You have the bedside, and then you go into health and wellness. What aspects, if any, of nursing life you'd like to see change?
I think the environment, I think in some levels it is starting to change a little bit because of COVID. There's more openness to self-care and
Mm-hmm.
understanding what nurses actually do, and
Yeah.
providing room for discussion. And the nursing shortage now is making hospitals take a little bit closer look at what they provide outside of just salary. So that's what I would like to see. I'd like to see a more nurturing environment and some wellness care, not just nutrition and exercise, but mental and emotional um, opportunities,
Yeah,
you know?
yeah. And so you mentioned self-care, and that's the question I always ask because I always want to know what self-care means different things to each of us. So what does it mean to you?
Well, for me, there's the obvious, which is your physical, you know, sleep,
Mm-hmm.
nutrition, exercise. But then there's the other part of that, which is emotional connection and managing your thought processes. So, you know, being able to do either breath work or meditation to turn on your parasympathetic nervous system so that you can actually allow your brain to go out of hypervigilance into a place where you can be thoughtful and considerate of what's happening in your own brain and separating yourself from your thoughts, deciding, whether a thought is serving you, whether a thought is even true, and then determining what you need to focus on. So a big part of my own self-care and what I teach other people is the empowerment of managing your own body and brain. We think that many of us just think that we're just reacting all the time to people around us when we don't have to. Our thoughts are not who we are. They're just thoughts, and they come. That's what your brain does. We have 67,000 thoughts a day, and we get to decide.
At least. Yeah. So you try to teach people. Do you find it's difficult to learn? That's a concept that's difficult to get across?
No.
Okay.
No, it's surprisingly not. The last year I worked primarily coaching people with cancer, somewhere in their cancer diagnosis, anywhere from new diagnosis to in treatment to post treatment, and either terminal or cancer free, but still having all the emotional stuff. And I think once people feel the shift of being in the stress response to being in a relaxed, the rest and heal response, and you ask them simple questions, it comes very easy.
Okay.
Like one of the questions is, what's most important to you in this situation right now? What's the most important thing? And when someone gets into that place where they're calm and can think about that answer, it clarifies things in a way that then allows them to kind of examine it further. Why is that important?
Oh, okay.
You know what I'm saying? Once you get a clear question and they're with you, then it's easy for them to see, I think.
Okay. Awesome. And so you are an entrepreneur. You have Joni O Nurse Coaching.
Correct.
Tell me about that.
Well, it kind of came to me, just out of the blue, like many things do. Several years ago, one of my nurse colleagues, one of my mentors, I think she was, emailed me, called me, I don't know. She said, "Hey, I came across this thing and it's perfect for you." She was actually looking for a graduate program for herself, checking out all the things, and she came across nurse coaching. And so I was like, "Okay, great. I'm busy. Don't have time. I don't even know what that is." But she planted a seed. And so during, I want to say 2019, I started just really looking out there. What is coaching? What is it? Life coaching, health coaching, nurse coaching, and just started consuming everything I could come across regarding that. And then found the integrative nurse coach program, which I did in 2020, which just really connected. It was just huge for me. A lot of things I had thought about all my life were all of a sudden theories backed by actual science. I was like, okay, it was a huge connection. So life happening the way it does, I was able to use coaching in my position in the hospital. We had created a program and it was going very well. So working with cardiac rehab patients and cancer patients. And then as that process was going through, I just knew that I could help more people. That I loved my job with the hospital, but there were, I had kind of outgrown it. I think I was ready to move on. And so I had started my business in 2021, coaching people outside of the hospital, and it just is unfolding. It's going well. And then so in 2022, I cut my hours way back at the hospital so I could spend more time on my business. And so that's what I'm doing this year. And it is just unfolding, and I'm loving it. I've added speaking and presenting, and so that's going very well also.
So you speak to present to community groups?
Community groups. In October, I will be doing a keynote address for a conference. It's our state literacy group for adult educators in combination with one of the vocational programs. And so it's for adult educators. And then I'm speaking, I've got some things organized with the university for students. And of course, I do local community.
Yeah.
I'm looking at doing some things with the hospital with some of the nurses, and just wherever people want, wherever they want to learn more about managing their body and brain, managing overwhelm.
Yeah.
And that's everybody.
That, I was just about to say, who doesn't need that? Who doesn't need that?
It was funny. In last March, I had applied to do a presentation for the university. It was a conference for people who hire graduates from the school, or they recruit interns, whatever. So I applied to managing, or my topic was managing overwhelm in the workplace, and they said, no, not really a good fit, but you can come and lead a roundtable at one of our breakout sessions. And you have to pay to do it. And I thought, okay, I'll pay. I'll go do that. Just get the experience.
Of course.
And I got there, and I, had my little table, and it was just a 1 hour breakout session. And the participants would do 20 minutes at each. They got to choose 3 tables they would spend 20 minutes at. So as the presenter, I got to talk to 3 groups in the hour for 20 minutes. And they had all these tables, and my title was simply managing overwhelm. And, there was probably room for 10 or 12 people at the table. And there were people standing like in line, waiting for their turn.
Yeah.
Just because everybody's overwhelmed.
Everybody, yeah.
And they want information. And so that's how I got the next speaking gig with the university. They're like, oh, there's something going on there.
Well, at least they were open to it. At least it struck a nerve with them too. So good for them. At least they were paying attention. So I ask people because I want to know how we see each other as nurses. And so my question to all my nurses that I speak to, all the nurses I speak to, is this: if you had to describe the most essential quality of a nurse in just one word, what would that word be?
I think compassionate.
That's a word that comes up a lot. We see ourselves as compassionate. Here is the thing, though. We see ourselves as compassionate, and I absolutely agree with that. I see how that comes about. What seems a little bit at odds to me is that we're compassionate with everybody else except ourselves, and sometimes except our colleagues. This is how I keep hearing this thing, we're burning out. Nurses eat their young, that kind of thing. And so we know that we recognize compassion in each other, but somehow we're not seeming to give it to each other. And I don't know why. I don't know why.
I think another word that I would choose that would be more clarifying would be presence.
Presence, okay.
Because, I think one of the reasons we probably do those things, don't show compassion to each other and eat our young and all that, is because we're not in the moment. We're just reacting.
Yeah.
We're just doing whatever it needs to be done and going with the flow. And, we're not actually present and considerate about the things we're choosing to say and do and how they impact people.
Yeah. And sometimes I try to remind myself and others that I guess it's also a thing that if you're frustrated and you're trying to not let it show to patients, it is going to show to the other people who are supposed to be understanding you, if you know what I mean.
Yeah.
It,
And that part of that too is, if you're present, really present and watching your thoughts and actions, then you can decide
yeah,
that I want to share with my colleagues
yeah.
what's going on, or I want to let my vulnerability come out,
Yeah.
or I want to tell my patient, I don't know the answer. Give me a few minutes,
Yeah.
or whatever. But being able to just acknowledge I'm overwhelmed in the moment. Can I just give myself a break?
Yeah, 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 yeah. I used to tell students, I come from a very, very small island in the Caribbean. And I'm from Montserrat, and people in Montserrat tend to always say hello. If I see you in the morning, I say good morning. If I see you again in the afternoon, I say good afternoon, and again in the evening. And if I see you 10 times a day, right? And so I used to tell students that this is who I am. So if the day ever comes when I come in, walk into a room and I didn't say good morning to you, then you know that this is the day you have to be very, very gentle with me. And I think we have to learn each other's cues. If we're part of a team, we have to be aware of each other's cues, and not necessarily that I have to tell you I'm having a bad day, but if we're part of a team, you should be able to know, hey, today's the day I need to help out a little more. Yeah. So, what advice would you give to somebody who wants to be a nurse? Because it took you a little bit, and your husband had to tell you a couple of times. So, what advice would you give to someone? First of all, is it just because he told you that you delayed doing it, or was there something that kind of held you back?
Honestly, looking back, I mean, that was 25 years ago, 30 years ago, however long ago that was, in the late 90s. I think I was simply in that reactive phase. I don't know that I was present to really say, this is what I really want or don't want. I was just, on the treadmill and just doing life and working. And I don't know that I spent a lot of time thinking about what I really needed or wanted.
Okay.
And that's the truth. It's hard to admit, but it's the truth. I didn't have deep thoughts about becoming a nurse and what I was like, okay, this works. Let's do it.
Let's do it.
And, and maybe it's not as you get older, it's just as you become more aware of, yourself is when you can start making those kind of connections.
Yeah, 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 yeah. So what advice would you give to someone?
I actually have a former employee of mine who just passed her NCLEX, and I'm so incredibly proud of her. And she tells me that I was one of the reasons she went into nursing. But so what I told her was, just be who you are and follow where you feel led. Because with nursing, there's such a diverse array of ways to go. You don't have to go right into medical surgical nursing like we were told
I
always.
know.
There's many ways to go. And so I say just experience what you can. She had actually texted me saying, she lives in Pennsylvania, and she said that there are places who have they call them nursing, I don't know what but it's like a 6-month program for brand new nurses.
Okay.
Should I do it, should I
That's it.
not do it, blah blah blah. And I said, well, of course you should do it. If you have the opportunity to have more time to learn the skills, to go to different areas of the hospital, to try them out while it's a preceptor
It's like
program, while you're doing it, yes, do it. Why would you not do it? The worst that's going to happen is you're going to learn some things that, you're going to use.
Yeah, yeah.
So I guess my advice to someone would be just stay open-minded and follow where you're feeling led. There's lots of ways to go.
So many, so many, so many, so many. And that's one of the things we get to showcase here is nurses everywhere, everywhere. Some of you can be, if you wanted to work at the airport, you can. Or if you wanted to work in the post office, you can. Or if you want
That's
to work at the
right.
coroner's office, you can,
I worked in a medical fitness facility as an RN for 9 years,
Yeah,
and it was phenomenal, untraditional nursing
yeah.
role.
Yes, yes. And that's a good word you just brought. You said it's untraditional. And we're getting to the point where we recognize that there's nothing traditional about nursing. There was the time when if you said to someone that you're a nurse there, the first question was, well, which hospital do you work in?
Mhm.
Right?
Mhm.
And even us, our thing was, the next step is to be, that's not necessarily the truth anymore. That's not the
Mhm.
truth anymore. And I'm so, so happy about that. I
Mhm.
really am, because I feel like too many people have left nursing because they felt stuck and did not know or did not realize that those skills can be used anywhere at any time.
Mhm.
Anyhow.
Yeah. That's what I love so much about nurse coaching
Hmm.
and the whole movement is, initially I was doing it not to start my own business. I wanted to do it within my current role. And I think that's one of the pushes with it is not that you're leaving nursing, bedside nursing or whatever kind of nursing you're doing. It's just adding
Skill.
skills,
Hmm.
coaching skills
Hmm.
to see people, help people see things from a different perspective and own their decisions and their reasons for their decisions. And that's powerful in all the fields of nursing
Yeah.
is empowering your patients, your clients, your people to decision making for themselves, for their own health, wellness
Yeah.
benefits.
Yeah. Yeah.
And so that's what I love about it. And I think with nurse coaching, as it's growing, they're not pulling people away from their current jobs. They're saying, here's stuff that you can
You
do
can
within
do.
your current job to be better, not only for your patients or your clients, but it's walk the walk. You got to walk the walk to talk the talk. And so
Yeah.
it's self
For
coaching.
you.
We're learning to manage your own self within so
Hmm.
that everything you do is authentic, which is a completely different vibration from your body than just telling somebody what to do,
Yeah.
you know?
Yeah. 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 One quick thing I wanted to ask you about. You said you did health and wellness,
Mhm.
but I also saw somewhere you were a cycling instructor. Tell me.
Okay. So my journey into health and wellness from nursing was kind of a funny one. When we moved, for when my kids were little, I stayed home for a few years with them.
Hmm.
Didn't work at all, or I
Yeah,
did. I never not worked. I did some PRN work
I got that.
in the hospital.
Too.
But when we moved to a new town, I was home with my kids. I just had my third child. I was like, she was less than a year old. I was probably postpartum at the time. And I found a class called Zumba. So this was
Okay.
way back in
Yeah.
2006.
Uh-huh.
And it was this weird dance exercise class. Of course,
Yeah.
everybody knows what it is
Yes.
now, but and it like sparked something in me, this connecting with exercise, connecting with women, and just finding my own little space for an hour of the day lit me up. It gave me a new perspective about my marriage, my children, everything. So I had found this exercise class and I was loving it so much. And I went for like a month. We live in a college town, and then the teacher, who was a college student, she says, "Okay, everybody, I'm going home for the
Uh,
holidays. I'll see you all back in January." And I was like devastated. What?
no.
I just found this, I'm getting the
Yeah.
endorphins and the joy, and I'm like, what do you mean? And the lady next to me says, "Well, why don't you teach it?" And I'm like, "What do you mean?" She said, "Well, you can do it." So I went home, I got on the computer, I found a class, a training class that was in the next 2 weeks in the next state over. So I went and got trained, came back, started teaching her class for her. And that started my connection to exercise and fitness with Zumba. And throughout the next years, I was so passionate about it that it was a way for me to connect with women and help them find a place, even for an hour, where they were able just to be joyous and connected with no inhibitions. And we're just, so many of us are trained to let go of everything that matters to us when our kids are little, when we're married, and we lose a lot of our girlfriend connections. And so for me, for the next decade, I did this, events, traveling. I do fitness vacations. I mean, Zumba was really the thing. Cycling came way later, but Zumba is what put me on this path. And so then I went back to work in the hospital I think I started back in the ER.
Yeah.
And in outpatient surgery, but people knew this is what I did. And then I started doing this in our medical fitness facility, the Zumba, along with coaching and nursing, with nursing and teaching classes. And so then I started teaching other kinds of classes and kind of got known as the fitness person. And so it was the funniest thing. People in the cafeteria would like show me their plates. Like, I'm like, okay, good job. I don't care what you're eating. And so that's how my job with the medical fitness facility kind of came about. When a position came open, they called me and said, hey, do you want to manage our medical fitness facility? I'm like, I don't know anything about that. I'm a nurse and I'm a fitness instructor. And they're like, do you want it? And I was like, well, I'm not saying no, I just don't know anything. And so that's how I got into that position as a nurse. They'd never had a nurse in that position before. So it was a new role and changed a lot of things. So as a Zumba instructor for all these years now, and then I got multiple other certifications, different kinds of things. And cycling was one of them. I love it. It's not my passion. Zumba, dance fitness, active aging, memory work, that's where my passion in fitness is. But yeah, it's been quite a journey. I love it so much.
I can tell. I can tell. Joni, I don't know how to thank you for this conversation. It has been fabulous. Thank you so very, very much for doing this. I appreciate it.
Thank you. And thank you for what you're doing. I think the connection is fantastic. And I would love to see just more nurses, getting on and sharing what they do. I love hearing the stories about what others do.
Yeah.
It's fantastic. So yeah, thank you for what you're doing.
My pleasure.